Hi, everyone, and welcome to The Breakouts, a podcast where we interview extraordinary founders that are on the rise and then package the insights from their interviews into short 20-minute episodes. I'm your host, Akkshay. Now, season 1 of The Breakouts is focused on emerging verticals, areas that we think are underexplored, but have the ability to be huge over the next few years. Areas like Web3, health tech, fintech, AI ML, prop tech, and so much more. As some of you may know, we're a fairly new podcast, so some of these episodes might be a little rough around the edges, but they'll still feature amazing entrepreneurs for you to learn from, and they'll still be packed with actionable insights that you can take away to build your business. Now, just before I introduce today's guest, go ahead and show us some love by following us on Twitter at The Breakouts Pod and subscribing to this YouTube channel. We're really trying to make the best podcast out there for aspiring entrepreneurs, a podcast that we wish we would have had when we were building our first company. But in order to get there, we're going to have to be iterative and improve on this podcast, just like you would iterate on a product that you're launching. And the number one thing we need for iteration is your feedback. So any advice, tips, constructive criticism, whatever you have, give it to us. We're all ears. The number one place to do that is going to be our Discord community, which you can find the link to in the description below. And I think that's everything. So without further ado, here's today's guest. All right, ladies and gentlemen, welcome back to another episode of The Breakouts. Today, we have an awesome guest lined up for you. We have Jarrad Aguirre, the co-founder and CEO of Miga Health. He's recently raised a $12 million seed round in the health tech space, and he's here to share his learnings with us today. Jarrad, how are you doing today?
I'm doing really well. It's great to be with you and to jump into this conversation.
Yeah, Jarrad, your company seems so exciting. I'm really excited to talk to you today. So as you know, we're going to be doing 2 episodes together. In this first episode, we're going to focus on the story behind your startup, how it works, and how you think about winning the industry. To just get us started off, in a few sentences, could you describe what your startup does and what problem you're trying to solve?
So at Miga Health, we're a heart health company that's combining delightful consumer product and full stack clinical services to prevent the next million heart attacks and strokes, and we're starting in hypertension. And so the problem that we've set out to solve is really enabling people to live the long, healthy lives they deserve. And there's no better starting point to do that than heart health, since it's the leading cause of death and the leading cause of morbidity in the United States and beyond.
That's crazy. Are there any statistics here that you'd like to share with us about heart health in the U.S.?
I think a lot of people recognize that cardiovascular disease is the leading cause of death in the United States and in many places across the world. I think what folks fail to appreciate is the magnitude of the cost, which in the United States alone is over $500 billion a year and is quickly increasing just as we all get older. But I think in addition to that, what really we find most outrageous and what really motivated my co-founder Dre and I to start Miga Health is just how much of the bad outcomes in heart health, like heart attacks and strokes, are preventable. And so a full 80% of premature heart attacks and strokes are preventable. And a heart attack or a stroke happens every 20 seconds. And so the human toll of the status quo in heart health is totally abysmal and unacceptable. And so it's one thing to know that heart health matters and it's big. It's another to recognize how different the current state could be. And that really was the initial hook for us to start and build out Miga Health.
That's crazy. So 80% of heart health-related deaths are preventable, and there's one happening every 20 seconds. I think it's really interesting here, Jarrad, that you've honed in on a niche that's very specific, yet it's very large in magnitude.
Exactly, and I think we can talk more about this, but it's one of the oversights of health tech, I think, right now. There's been a lot of great company creation in really important areas like women's health, behavioral health, and others. But you look at heart health, which really affects all of us. There isn't a single person that will navigate life that won't need a diagnostic, that won't need to be screened, and more than likely won't need some sort of treatment. Hypertension or high blood pressure, where we're starting, just as one example, it impacts over 110 million Americans, and there are around 200 million American adults. And so it's really 1 in 2 people in the United States who have hypertension. And so it is this total mismatch between the abysmal status quo that we find in heart health, the ability to not only dream up, but execute on a better tomorrow, but the fact that it's so large and there's so few companies that have entered the space to date. It's really wide open right now, but it's also in need of a number of companies to step up and really to create great products and services. Because every day, if not every minute that passes, that we're still operating as we are, it's literally heart attacks, strokes, deaths on the line. And so it's not an exaggeration. It's like it's life and death with what we're working with right now. And so that's a motivation that drives us at Miga.
That's truly inspiring. I love how you guys are paving the way for a lot of future companies and solutions to come. I'm curious, Jarrad, what is your personal background? What were you doing before, and what kind of led you to this journey?
Yeah, so my background's a little sort of atypical in wandering, but the common thread really starts with my sort of roots in the great state, of Colorado. Growing up with a single parent, low income household, really seeing sort of the inequities and just the total sort of like unacceptable, mechanics of U.S. healthcare that really planted a seed in me. This sort of long-standing interest and desire to make U.S. healthcare a little bit better, a little bit fairer, recognizing the very real toll that it has on people all across the country. And so initially what that led me to do was actually to train as a physician. No doctors in my family, no one involved in healthcare. But at the time, it's like, how do you change healthcare? You become a doctor. So it's a little bit simplistic at the time, but that was my marching order. And so I went to medical school and business school at Stanford. I started residency in internal medicine and primary care at one of the Harvard hospitals, Brigham and Women's Hospital. But I actually dropped out of residency midway. The year was 2017. Things were happening in the country. And I had this unique opportunity to join a recently IPO'd women's health biotech company. And almost nobody develops medicines for women. And that's not an exaggeration either. And it was started by a real trailblazing, amazing female physician CEO. And so I left residency, I left medicine, left Boston, which is really this mecca of healthcare, in order to try to build something in women's health. And so that's what I did for 4 years. I was on the management team of that company. We got some medicines approved and launched, and big partnership with Pfizer and the development and the commercialization. And that company, Myovant Sciences, is still moving ahead and doing great work. But last year, after our most recent FDA approval, decided that I wanted to get back to my roots of healthcare delivery in primary care, and actually had a number of experiences exploring partnerships with health tech companies while at Myovant that really convinced me that, one, many of these companies do not put enough emphasis on consumer product. Two, many of these companies know surprisingly little about the clinical data and sort of histories of their consumers. And three, many, just based on background and not intent, don't have a full picture of healthcare and are missing the bigger opportunity to build even bigger businesses and contributions through health tech by being a more sort of integrated company. And all of those experiences prompted me to start Miga Health with my co-founder, Dre, and to continue that path and that passion to make U.S. healthcare a little bit better and a little bit more fair.
That's awesome. It seems like you had such a well-rounded background, ready to build a health tech company, right? You mentioned you went to medical school, you went to business school, and then you also got some operational experience in health tech. That's really interesting. Transitioning a little bit over back to what the startup and what it does. So when I look on your website, I see a great vision there. I see some great statistics that help us as consumers understand the problem, but I don't see as much about, hey, what is a product? How does it work? I'm going to take a wild guess and say that you guys are still building the product, or it's in beta or something.
Yeah, that's right. And we can definitely dive into the details too in terms of the specifics of the product. But certainly what our website and the way we think about what we're up to and the task ahead, like it all flows from purpose and vision. And so for us at Miga, our purpose is to ensure that everyone achieves the health they deserve. And our vision, the world we see that will happen. And the question is not if, it's when, and by whom, is that there will be a future state in the US and really sort of everywhere where heart health begins at birth. And it's really this longitudinal engagement around sort of prevention and really pushing for better heart health. That's going to involve much more of a consumer brand and a relationship with a company like Miga that's coupled with clinical services to get the products you need to have the best heart health. And so we see it really as this master plan that we're executing against right now, which is to, on the one hand, build consumer product that's 10x better than what you typically see in health tech to get the engagement that's required. And then number two is to really deliver personalized plans and full stack clinical services, starting in hypertension, but then extending to other areas like high cholesterol, diabetes, and obesity. And then three, getting the health outcomes that will enable us to have as our key customers, sort of payers, and employers over time. And then expanding that initial footprint and even broader purview. And so we really see our kind of two pillars in terms of the products that we're heads down building right now is consumer product through a free consumer app, which we should chat more about, but also full stack clinical services. And it's really through the merger of those two, which does not exist in that form in heart health right now, that we'll be able to demonstrate that we do excellent work for consumers, and that has currency, and that has a lot of need and sort of interest from payers, employers, and other kind of key customers in U.S. healthcare who are really saddled with, in their own way, an unacceptable status quo in terms of how heart health is managed today.
So much to dissect here. In terms of that second pillar, the clinical services, do you mean that you're going to be catering to providers?
Well, you take a step back and you look at a lot of the great contributions of companies to date. Companies like, Omada is a great example, Noom, others. Heart health is one of those categories that we know the behaviors that promote it. We have the diagnostics and the therapeutics to improve outcomes. We have the care pathways that we can execute against. And so it's different than Alzheimer's or some other category where we're waiting on scientific breakthroughs or waiting on innovation. This is really like an implementation problem, an engagement and an implementation problem. And so many of the companies that have come to date, they're not clinical. What that means is they don't have clinicians, they don't write prescriptions, they don't order labs, and they're really providing sort of a lifestyle intervention that typically comes in the form of coaching. Lifestyle change and coaching is really important, and it's something that we certainly will support. But the reality is we have super cheap, super safe, super effective medicines for conditions like hypertension, hyperlipidemia, and others that if you leave off the table, you're really constraining the good you can do and the outcomes that you can drive. And so when we say full stack clinical services, we see a very significant opportunity to build a healthcare company of clinicians with clinicians that can actually take the actions and pull the levers that will drive the best outcomes on heart health. And so you just don't see that in the market in the way that we're doing it. And it's also a way to build a much bigger business, frankly, because then you can partner with payers and employers in ways that actually have more significant opportunity in terms of value-based sort of contracts and you really delivering value that you participate in over time that goes beyond the relatively modest gains from coaching and sort of lifestyle guidance, which sort of has a ceiling for the vast majority of people.
Value-based care and direct-to-consumer seem like these two emerging trends within healthcare. I love that you're just on the cusp of that. I'm curious, could you walk us through a user journey from the moment they discover your product to value realization?
Yeah, why don't I start with the other sort of prong of our kind of suite of products, the sort of full stack clinical services, connected devices, labs, pharmacy, telemedicine consultations. But really what we start with is this consumer app that we're building out that we haven't yet launched that will be character driven, gamified, think sort of a hybrid of like a Duolingo, a Headspace, and like a Candy Crush, really with the recognition that everything stems from engagement over time. It does not matter if you have the best clinical services if you don't have participation from the consumer. And so we like to do a thought exercise. If you think about companies like Calm or Headspace, like what if at time zero, they tried to build consumer product, but they also tried to build clinical services at the same time. You see that with Headspace and Ginger merging and sort of efforts that Calm have made as well. But you got one piece of the puzzle, but not like the whole picture. And so we see through this sort of consumer sort of app, which will really support people at the outset with high blood pressure to measure their blood pressure at home, do medication tracking and a few other actions, but will be part of a real kind of delightful sort of gamified experience that we'll make available for free to the mass market, because every single person with hypertension, every single primary care doctor with patients with hypertension, they're trying to figure out how do you collect data at home and then how do you share it out. And so we see a significant opportunity to have a suite of products where we have a free product offering through a consumer app that can be uptake by the 100 million plus people with hypertension. And that serves as like a pipeline and a guide to our more fully sort of product, which will be the consumer app with integrated sort of clinical services. And so as we think about acquisition and bottoms up interest from both consumers and physicians for what we're doing, we have a consumer product that's free on the market to enable that initial foothold. And then in more isolated pockets, initially just a state or two, we'll provide the full offering of clinical services, collect that data, those outcomes, and that will serve as part of our value argument to sort of payers and employers over time to ultimately pay us for the full offering.
That's really interesting. I'm curious, though, if we can go a little bit deeper. Let's say that I, for example, am a person with hypertension, and I learn about your app. Could you walk me through what happens next?
A canonical example, and this is something that isn't widely known either, is the average person with hypertension is diagnosed in the late 30s, early 40s. It
But
is
they have
true
it
that
earlier.
they have it earlier, but also this image of someone who's 78, hypertension on Medicare, that person exists and they need better solutions too. But the average person at diagnosis is actually quite young. They're diagnosed by a physician. The physician has a very short amount of time. They're trying to cover a lot. They're trying to set that person up for success in what follows. Every person with hypertension is asked to go buy a blood pressure monitor and to measure it at home. And that's because it is now consensus that the data you get from within the office is so poor that you actually need people to do it at home. And so every day across the country, you have this interaction between a doctor and someone newly diagnosed who's actually quite young, that you need to go buy a monitor, you need to start collecting your data, and we're going to use that data to then inform treatment decisions in terms of the medications you need. And so the future that we see that's quite exciting is in that conversation, just as that primary care doctor today would suggest informally calm or headspace for someone, struggling with anxiety or trouble falling asleep, that they would recommend Miga informally. That consumer would download our app. They would then be taken on a journey, a la Duolingo, where they would have a daily task list of things to complete, including taking their medicine and measuring their blood pressure. And then they would be incentivized through traditional sort of gamification mechanics to keep completing that daily task over time. And then the fully realized version is that person would then be connected with our physicians. And so they'd be collecting their blood pressure at home. It's too high. We prescribe them a medicine to bring it lower. Maybe they need another medicine. We titrate it. And then we basically create these personalized plans, but also deliver the products in labs, devices, and prescriptions in order to get people to goal. And every point of blood pressure that's higher than it should be leads to very significant sort of risk over time. And so that's ultimately the pathway that we imagine and will be supporting, where we're an augmentation, an ally of the primary care doctor, and we're solving shared pain points for both the consumer and the physician. But it's a longitudinal relationship for condition-specific needs like hypertension that we'll be serving over time.
I love the gamification aspect here because if you think about cardiologists today, it seems like even the best ones do not have any kind of means of keeping a patient accountable. A large percentage of patients don't even know how to take their medication properly. And even on top of that, when they're looking at blood pressure data, most of the times they don't have accurate data because there's no accountability to check it. Is it correct in saying here that this gamified consumer app that you're building is actually a wedge into building your own online telehealth clinic, and that the majority of the earnings or the revenue that your company makes are going to come from that clinic?
Yeah, that's right. Our monetization strategy, for a variety of reasons, is not to predominantly lean on, say, a premium app or a subscription service for the consumer. On the one hand, that really limits what's possible. US healthcare is not a cash pay industry. Over time, as we look to support branded medications, as we look to support more sophisticated diagnostics, et cetera, I don't care how wealthy you are, you're not going to be reliably accessing those in the US without insurance. And it's also an equity consideration. It is true that we could make a decision to build a row for hypertension. We could charge a bunch of money for it, and we could cater to those who are quite well off. But we think that's missing the broader opportunity to build something at scale and something that's more sort of inclusive and meaningful. But it is that wedge, to your point, and something that we think is quite defensible and quite differentiated compared to what's on the market, is if you can win the hearts and minds and engagement of consumers and physicians through something free, but super high value, from there, you can actually lead to significant sort of consumer aggregation. And then if you're also the one who's delivering these high impact products like medications to get great outcomes, that's a winning recipe to doing a lot of good across a lot of kind of related conditions and heart health like those I've mentioned. And so we're starting narrow in a very big category of hypertension, but it's really meant to be a blueprint for expansion over time. And I think one of the misconceptions too about people with these conditions is they're younger, but also they're tens and tens of millions of people who are diagnosed. They're seeing their doctor, they're on treatment, and they're still not at goal. And so it isn't this cold start problem of getting somebody from not caring about their health to suddenly becoming a model citizen. You have people who care a lot, are extraordinarily stressed and worried about what will happen because they don't know if they're doing what they should do and their numbers aren't where they should be. And so there are millions and millions of people sort of in that category who aren't being served, but are already activated. They just need the right partner and the right product to actually translate that activation into the outcomes they deserve.
Very interesting. Let's shift topics a little bit and talk about your business model. Because what you're building sounds phenomenal, but I'm curious, how do you earn money from this?
So I think that's one of the key questions as you build a company in healthcare is where do you initially innovate and where do you follow the path to date? As we have this conversation about consumer product and how you build out the gamified experience, that's very distinct compared to what's on the market right now. Where it makes less sense from our perspective to innovate from the outset is on the business model. And so where we see the big opportunity over time is through value-based care, is through being held accountable for and getting paid for how well we bring blood pressure down, bring cholesterol down, control diabetes. But there are a number of ways that you can make your way there, including fee-for-service reimbursement, which means we get our providers within payer networks, they complete great care, and they do standard medical billing to get paid for those interactions. And so there are a number of tried and true ways to monetize clinical services that are needed that aren't trying to reimagine how funds flow in healthcare, but are a very predictable and standard way for you to ultimately be compensated for the care that you're delivering. And then you use that sort of initial wedge over time to build up data. You use that data to then go to employers to enter into contracts to serve them. That's what Omada does, Hello Heart, like you name it. That's a very common sort of pathway, but also to then have the outcomes to have conversations with payers about programs you can support as well. And so if you look at a lot of the companies on the market right now, the more typical approach is to initially set up a pilot with a payer or an employer at the outset. That's what a lot of these companies have done. We think it's actually one of the fatal flaws, though, if you play it out over time, is if you immediately start working in a pilot capacity with payers and employers, your product is a little bit captured by their needs and their wants. And so what we see as a significant opportunity is to use fee-for-service and other sort of bridge monetization efforts to build up our product, to build up our organization, and to build up the evidence base so that we're not begging payers and employers to work with us. There is demand for payers and employers to work with us because we have demonstrated great data, and often it's the other way around. You need the payer and the employer to get access to the covered lives to then generate the data. And so it's all to say, we're not reinventing monetization in US healthcare, but what we're doing is we're taking a more delayed approach to ultimately deeper partnership with payers and employers. And we think that will give our product the space to ultimately become truly consumer so that we don't fall into the trap of being a sales-led organization, which is what you typically see in healthcare. And that's, from our perspective, how innovation gets curtailed, especially when the most important thing you need to do is engage. And so if your product isn't alive and evolving, that's going to be extraordinarily difficult to do in the long term.
So would you say that in the near term, you guys are going to start by taking the outcomes from this gamified consumer app that you have and billing insurance providers, and then once some of your consumers are also booking appointments with the doctors that you have on the app, you're going to take a fee there similar to how hospitals take fees on top of doctor visits? Are those the most immediate forms of monetization?
Yeah, it's fee-for-service reimbursement. So just as you see your primary care doctor, if you do, and have an encounter, like that is a billable event, there'll be multiple nodes along our care journey that will be billable and that are like totally normal interactions that happen in healthcare every day. We will use that as a bridge to build up a large corpus of outcomes data to then demonstrate to payers and employers what we're capable of and why they should partner with us. And we think that is the advantageous path, which is you're still building a business along the way, but you recognize that the most aligned way with consumers, and we think the most appropriate way to build a business, is to be held accountable for the value that you deliver, and that means outcomes. So our big bet is on having the best healthcare organization on the market coupled with the best engagement, and you combine those two together, no doubt your outcomes will be much better. Because again, at Heart Health, we know it works. All the products exist. It's not a mystery. Doesn't mean it's easy, but it's not a mystery. And so we know if we deliver on those things that our outcomes will be by definition much better than what folks are used to seeing.
Awesome. Cool. I think that makes a lot of sense. We're running a little bit over on time here, so let's wrap up this first episode. I'm really eager to talk to you on the second episode because I think there's a lot of things to dissect here. Just as we wrap up, is there anything that you'd like to plug? You guys raised recently? Are you hiring? Feel free. The stage is all yours.
Yeah, I think anyone who's interested in our purpose at Miga, which is to ensure people achieve the health they deserve and are excited by what's possible in heart health, really encourage them to reach out to me on LinkedIn or Twitter. We very intentionally on our website have a build your role channel. Most of the people on our team today came through that channel. And so what we're interested in is getting connected with A-plus purpose-driven people who are ready to create a new future in heart health. And we don't presume to know who those people are and what functional space they may be in. And so we are open for business in terms of hiring, but also for hearing proposals from people for how they can add value to what we're up to at Miga.
Awesome. Cool. You heard it, folks. Check out their website at migahealth.com. You can see their careers listed right there. And I think it's so cool that you guys do this build a role thing. It seems really interesting. Lastly, if our listeners want to connect with you, what would be the best place to follow you? Would it be Twitter or LinkedIn?
I think LinkedIn or Twitter are perfect. I'm a big believer, whether it's folks interested in working at Miga or just other folks in solidarity trying to make U.S. healthcare a little bit better, that we need community. We need to uplift each other. And so I'm always happy to connect with folks who are interested in the space more generally, or more specifically, what we're building at Miga.
Awesome. What's your Twitter handle?
It's at Jarrad Aguirre.
Awesome. Cool. You heard it, folks. And there you have it. That's today's episode. Jarrad, thank you so much. The way you articulated things was just a treat for both me and all of our listeners. Everyone, we're going to see you next time on the Breakouts for episode 2 with Jarrad Aguirre.
Great. Thanks so much.
All right, and that wraps up today's episode. We really hope you enjoyed it. Now, just before I let you go, I wanted to reiterate one thing. We're trying to build the best podcast out there for aspiring entrepreneurs, and to do that, we need your help. The best way you can help us is by joining our Discord community. The link is in the description below. And then leaving us feedback. Tell us how we did. Tell us how we can improve. We're eagerly waiting to hear from you. Other than that, show us some love and follow us on Twitter at The Breakouts Pod. And I think that's everything I have for you. We'll see you next time on The Breakouts.